The World Health Organization is on Wednesday expected to declare the Ebola outbreak in Uganda over. The country's health minister said Tuesday that 42 days had passed without an Ebola case detected. This expert says Uganda successfully mobilized the community.
What we have seen in Uganda is that they have built trust in the community over years, so that when the outbreak occurred and people are being told what to do, they are not seeing it from a suspicious eye, and conspiracy theories could not be able to overcome and cause fear among them. So very, very important that community members must be directly involved. We must build trust in the community, not just for Ebola, but for everything else, including the routine vaccination and any other outbreak that might occur.
Uganda was hit by the Sudan strain of the virus, which, unlike the Zaire variant, has no proven vaccine. Trials are currently underway using an experimental drug from the United States.
As Africans, with diseases that are predominantly occurring in Africa, we are still hugely dependent on the Western world for technology, for vaccination, for development of vaccines and for treatment, such that you see, yes, despite Ebola occurring in Africa for many years, we are still dependent on these countries to bring for us the vaccines. And unfortunately, the Sudan strain of the Ebola virus has no vaccine as we speak. It's only now that there is a trial happening to develop a new vaccine. We have to wake up as Africans.
The East African country has recorded 142 cases, including 56 fatalities since the Ebola outbreak was announced in September in the central district of Mubende.
Uganda actually has a very good public health laboratory system in place for testing for Ebola, and frankly for other diseases as well. But particularly for Ebola, because of the many years that they've had to deal with Ebola, they're able to test Ebola and confirm any suspected case literally within a day or 2 days. And because of that, when the first case was suspected and they were able to make the diagnosis, that allowed for a quick public health response from the government.
The World Health Organization has said the fatality rate of the outbreak was about 40%. The epicenter of the outbreak was placed under lockdown for over 2 months.